I just wanted to mention that the with Measure 91 and lots of legislative changes to come, I know that patients in the program are really eager to get timely information and accurate information about what the future holds for them. And I know it may be simple answers that people are looking for, but I just that's one thing I was excited about the newsletter, is that it could explain things to patients about what's happening. So I'd love to see some way of with the new website design answering questions that you'd anticipate from patients.
Or actually, even with the redesign of the webpage as it's ongoing now, I can really see the three most frequently asked questions in the last 30 days and the response to those, because if you're getting the same question over and over by patients, likely is there's 100 that haven't asked but would like to know that. And, not 20 or whatever, but maybe the top 3 or top 5 most frequently asked questions this month or this quarter or whatever. So that comes right up front. That's a good idea.
I'm actually really glad that you brought that up, because that's an idea that we are working on, and we use Adobe Forms, are often used on the state website. So we've created a couple drafts where people would be able to submit questions like that, general questions, and we can post the answers on the website.
Where everybody can.
So that and then they'll be actually able to. It's a draft, so we're still working on it, but that's one of the intentions.
No, that'd be awesome.
Yeah, and also on that subject, there's also a big interest with legislators and policymakers, because just seeing the dialogue, on the OLCC task force and my meetings with legislators and et cetera. I think that a lot of policymakers and lawmakers are really wondering, what value the Oregon Medical Marijuana Program has, with adult use coming, and I could think of a million and one good reasons why this program is important. But so I would encourage the program to, kind of come up with some good points to communicate to policymakers about the types of patients that are on this program and how they benefit from just having a card. The under 21 patients, who need medicine for epilepsy or whatever. I just challenge you to advocate for your own program in that way.
Yeah, I'm glad that you mentioned that. The first thing that when we saw that the legalization of retail is that Steve, the administrator, my boss now, put together, because there was all these questions from other programs, because we are public health, and the first thing is health risk, is what they're thinking and how we're going to communicate this out. And he has a work group to come up with a plan of how the retail piece and the recreational piece is going to play, and our role is the medical side of playing it. So we do have some that's been established to help address that.
Okay.
So, and your question helped me, because those are the type of questions we're looking at. The evaluation piece, that is my role, evaluation piece for the medical marijuana, and looking for those types of questions, like what you said, the value of the medicine to those that's on the program. That's a good question. So, and I jotted it down right away.
I was going to say, it's Todd brought up though, even following those who've gone before Oregon now from Colorado, they really thought long and hard about what will open retail sales do to their medical marijuana program. And really they kept the two very separate. And I think you saw a clear benefit from keeping them separate. One is, as much as the vote brought in the open retail sales of cannabis here to Oregon, another vote could take it away. If you do away with the medical marijuana program as a separate and distinct program.
Paul, I really do want to get as an agent interrupt, but we've actually had that as a discussion at 11:30 to 12, directly discussing that and brainstorm that, and I'd love to hear that. I think that would be great.
Yes.
Okay, I'm just getting I assume you're talking about something like recently in the news there were stories about how young folks are helped by marijuana with young folks with epilepsy. Is that the sort of content you're talking about, like getting up immediately, not waiting 2 months to get a permit?
Yeah,
Is
because
that-
people don't know that that they will still be illegal if they're not 21, which means that that if they're a minor or under the age of 21, they will not be able to access this medicine or recreationally legally. And so that's a big problem, obviously among a long list which we'll get into. But so I think that yes, I think the point is that I think what Todd's saying is to really encourage you guys to actually speak that truth, because without you having a voice around it, there won't be one. And that brings
Well,
up,
you guys too.
well, no,
So
what
if you
I'm,
could-
what I'm saying is like that's our point is that
Right.
is that at this point, no, it's yeah, we're all together in on that, and that's because and that brings up my question that I noticed is that when you talked about that there's 3 new vacancies in employment, and so one of the things that I want to check too is a morale standpoint, because I can understand that if I was working for the
Right.
Oregon Medical Marijuana Program, I'd be looking for another job.
Right.
And so, because I would think that there isn't going to be one for me. And so that combined, and so I'm sort of guessing that that's the case here, those 3 vacancies, is that a, I mean, I can't address those 3 vacancies or phrase that. Is the morale decreasing based on the legalization that has occurred?
There's questions, but those vacancies wasn't for that
Yeah,
reason.
and I understand they never are, and so that's what I meant to
But
say.
I do
was-
know that
yeah.
staff are looking,
That, exactly, and so.
and they question that.
Exactly, and so the question, to get back to its origin, and I don't, as you know, I'm not always too succinct, but sometimes, but the question would be, and the statement to consider is that properly and effectively communicating the value of the Oregon Medical Marijuana Program above and beyond that we are, because the old mantra was for many, many years, we are just administering information, we are just administering information, we are just administering, we are just administering, and that's great, but if you keep with that, we're just administering, I don't think it benefits any of us. And so that's what what I think we're all requesting is that in my communications to you, I should say, is the request to strongly consider communicating to all your staff, not just that we're valuable, but why the Oregon Medical Marijuana Program is valuable beyond that we're just serving administrative good. And that's, I guess if you could if you could speak to the greater good of the program and still feel or still be in compliance with your job description, I think that would be hugely valuable to morale and the long-term viability, sustainability, and existence of the Oregon Medical Marijuana Program.
So you stated that you had a whole list of,
Yeah, you
of
have it in
different.
your file, actually.
Oh, it is? Okay.
Yeah, and then we'll be adding to it, spending a half hour
And it's
brainstorming
around
that,
the retail.
And we would love your
Okay.
feedback in that, yeah.
Okay.
Yeah, and I think one thing that may be useful for you to communicate is statistics. Like maybe adding to this sheet the number of under 21 cardholders.
You talking about our
Well,
statistic?
and
Yeah.
once again, I sort of cut off Paul, and I
Okay.
have cut off
Oh,
you
yeah,
too
yeah.
in the same, to be fair, is that I don't want to hear is basically what it is that I think we do have time to discuss that, and I want to discuss that. What I want to do is, this was the conversation I was having, was setting the stage for communication. We will follow up, and we were working hard to assist you with that.
Yes.
But I guess overall, what I want you to hear, the communication that I wanted to communicate to you, and I think we're in agreement to the board, is that we are in it together more than ever before. And we used to be, there used to be an adversarial feeling in the past. And the last meeting, I was hoping that there was a transition for that, and I think that there was something that shifted. And what I'm requesting is we build on that shift, and we build on working together more tightly as a team. And that's my request, because I think it's in all of our enlightened self-interest to not only play nice, but to be fervent advocates of each other and the program. And that's the overarching communication that I want to keep
Okay.
here.
I got the list, that's what.
Yeah.
When you guys were talking about the newsletter it needed to be vetted by someone else, is it, who does that?
Just to get into the context, I think we had an idea for a newsletter. We read by communications. They didn't feel that constituted a newsletter as much as here we're helping people with the process of how to get on the medical marijuana program. So I think that, unless I'm speaking wrong, I don't think it was an issue of you can't have a newsletter as much as that's not a newsletter that you're reading.
Yeah, they didn't say no newsletter.
The reason I'm asking is for later on in the conversation, what is it that the OMMP and its staff can actually do in terms of being able to communicate this stuff without having to clear it with other people within the Oregon Health Authority?
Are you,
How can we effectively and quickly communicate this information? Because if it takes 6 months, I think is what he's saying, to actually
Okay.
do anything and get any word out to the public, it'll probably
Something like a
be too late.
statistic, a factual statistic,
Yeah.
there's no issue with that. But if you wanted to say that the Oregon Medical Marijuana Program wants to write an article about how this program's necessary because of this, I think they're gonna have people above us that are gonna have to decide whether that's the appropriate role of the program. But that's not, I don't think that's a program decisions, I guess, we're trying to.
And but what I'm saying is we can take that
You have
belief
more
and
sway.
that's what I'm saying, work together to take stats to back up that conversation. We, just as it was pointed for years factually to ways to say no, right? Use those same statistics to say no, we can use those same statistics now to say yes to the program. And that's what I'm saying is that's a mental shift that we can make that although I get that structurally it can just be the facts, man, I think we could do it in a way that would benefit all of us.
The sign off in most of these cases would be the new head of the.
no, we go to communications.
Oh, okay.
Yes, we go to communications to review.
And the clearinghouse, they take it for all publications.
Yes.
It has to go through there.
Any other questions that anybody has for?
Any other thing, dialogue?
There is, I guess, one other dialogue that got brought up by Sandy, and I think now's a good time. We actually slated it for this time, is that correct? Yes, okay, I just want to confirm. In fact, did you want, because you were having the direct communication with Sandy isn't here, would you be willing to, communicate to it and then we can add on to it as well? Or do you?
I think I'm gonna defer to Erin.
Okay.
But.
Oh,
do you
Erin,
want
sorry,
that
yeah.
email from, I don't have the language here.
Here, hold on, I can pull it up.
She had an issue about one of our,
Great.
I don't know what it says. I don't want to incorrectly summarize. There was a question about one of the basic facts, and she brought it to our attention. It basically had to do with I think the stats, the basic fact basically said that the patients could give other patients plants and seeds as long as no consideration was paid for the transfer. And she raised that issue, and I reviewed it, and I thought we should stick to the statute, which just said that it's not considered a legal delivery for a patient or for a cartel to transport or transfer marijuana to another patient, as long as no consideration is paid, and leave off the plants and seeds.
So
Because
usable marijuana or
the
marijuana?
statute just says marijuana. It
Okay.
doesn't define marijuana, and so Sandy's.
But doesn't the statute define that?
Yeah, it
I'm not
defines
sure it
usable
defines
marijuana. I don't know why in that sentence it just says marijuana. So her retort was that patients have always been able to transfer live plants or seeds to each other. And we're simply saying we're not disagreeing with that analysis or that viewpoint. We just want to we don't want to state something that's not specifically stated in statute. If marijuana, if the common consensus is marijuana and live plants mean the same thing, there shouldn't be any issue, but we don't want to make a clarification that doesn't exist in statute. We don't think that benefits anyone if that interpretation isn't shared by, for instance, a prosecutor. So we didn't change a basic fact, we just quoted the statute, and that's where the discussion sort of.
But that did get correct.
We took out the seeds and live plants simply because that's just not stated anywhere in statute. And we just quoted the part about how if a card holder can give another card holder marijuana as long as no consideration is paid for the transfer.
Was that something just created internally, or was that edited or modified or created in any way from Shannon O'Fallon or different folks, or where did that come from? That verbiage, I guess.
You know where the original, we've been working on basic facts. They go through so many iterations. I think it just got kind of thrown in there. I don't know that was ever even.
I was just asking, have you mentioned
No,
that?
we didn't. wrote those by. And so it was actually, when Sandy raised that, I thought she was raising the concern that the statute doesn't state you can give plants or seeds to another patient. So I basically, in my feeling was I was agreeing with her, so I changed it. But I think what she was trying to say is that we should make that a point that that's allowed under statute. I disagree with that because it just doesn't say it in statute. We don't want to make statements that just aren't in statute.
Right.
We're not stating you
Either way,
cannot do
yeah,
this.
we're not,
just,
no, I was just, it was an intent question.
It was actually myself that did that. And we can have that discussion. I just don't think, because the statute doesn't say you can give live plants to another.
No, I was
patient,
just, my only interest behind that was if there was any. Does that make sense? Yeah,
Just
that's
after
all. Yeah.
reviewing it again, it didn't look right.
I think part of the situation here is like the OMP, the AMA, statutes refer to usable marijuana. And this does not say usable marijuana, it says marijuana. So if you find marijuana, you gotta go back to 47505. And there it says everything.
If we said usable marijuana, that
Except
would be
sterilized seeds and hemp.
Yeah. right.
Yeah, exactly.
And we didn't want to limit, and we didn't want to make a statement that you can transfer usable marijuana because that's limiting. That really specifies it can only be usable marijuana. The statute doesn't say that, it says marijuana. So we'll just let someone else interpret that.
Yeah.
Makes sense to me.
Fair.
Yep,
That was the
and
only
thank you,
reason.
guys. No, and that's, yeah, thank you so much for that, I appreciate that. 10:47. We're ahead, gosh, I love that. Are there any other dialogues or questions? Administration?
How are people, interested parties who want to participate on the ACMM, how do they become aware that the deadline has been extended?
only
Because
thing
the
we can do
email
is change
list
it.
still isn't working.
And then we thought we were going to solve that with the newsletter sign up. We're going to change it on the website, but I.
Can you do a press release or some?
Or can
sort
you
of-
have an information sign? Is there a way to do it to
Yeah, so
gather
that's
the
actually
information, we
getting
speak
out
up
to
and
the
opt
offside
in?
done. It's a great question.
Like maybe
Excellent
manually
question.
send it to the email lists, the e-subscribe list?
Let me,
Good idea.
I'm gonna get on that right after the meeting. I'm gonna talk to the folks in, that deal with our website and see what's going on with that portion. Because that seems to have fallen off, and obviously no one's getting the updates. And it's not direct, it's not actually our webpage that when we update it, sends it all out. There's some sort of intermediate website that does this, and apparently that's not happening.
And there is an additional thing, and I'm not, and please don't hear all these things as beat you guys up, but there is one other piece that I wanted to address that Cheryl and I were working together on the go-share, and she sort of switched jobs. One of the jobs that Cheryl was doing was reviewing letters when the public have questions for us as the ACMM, for us to address them, and
That's been fixed.
that's been fixed.
It has. I
Okay.
got the last letter that sent
Oh,
out. Yeah,
great.
Tracy and I dealt with that.
Great. So that is addressed, okay. So, and I just wanted to just put in the record that for any people that are listening now, or that may ever read back on it, for anybody in this short period that didn't receive a timely response, I want to personally apologize for that. It was not a conscious action. I did not get the letters and were not aware. And so I just want to just apologize to the public, and it sounds like it's been corrected, so thank you guys so much for correcting that and being on top of that. I really appreciate it.
I have a couple questions in regards to getting for people to apply. How do you guys communicate? How do you guys get information out there? Do you guys have some like a blog or anything that communicate on that community? Do you think we need more time than the 31st of December for them to apply?
I think we need, just like you hit it on the head, honestly, we need effective communication with the Oregon Medical Marijuana patients, which has never existed, and I'm really promoting that in any way, shape, or form, whether we call it a newsletter.
We have
or
an interested
email.
party list that I send out rules and stuff to, but people, and occasionally I hear somebody say, can you add me to that list? And
But I just didn't know if there's a way, I guess what I'm saying is that we have an email list, and I think we do at some level,
Yeah.
right? Where there are not.
Well, when someone signs up for those, I can go in, because I've done it myself, doesn't notify the program.
I know, it doesn't,
So
it doesn't
I
even,
need to figure out
you don't
who
even get
knows,
those things, yeah.
who has this list of emails that.
Yeah, that everybody signed
That's
up
what
on,
I'm-
yeah, yeah, so if there's a way, so I guess what my answer to you would be is that, no, we're sort of a ragtag volunteer group of people, and we're requesting that the organization, the Oregon Medical Model Program, we request that they submit it to send an email out to everyone.
Put it
That's
on
my
the
request.
website, we don't have any.
I know, and that's what I was
Well,
asking, that you do, it
Just for ideas, we could, I mean, I would be willing, if we came up with a blurb, I'd be willing to submit it to the Eugene Weekly. They've
Yeah,
got
we
those
can
free
press
papers
release it,
that you
yeah.
could just, you know, they'll
We can
put a
ask
blurb in
questions
there.
if we can do that. We put in the-
But I don't know, you know, around the state.
So yeah, so we can say, you guys have the ability to do the reach out press releases too, and they will sort of listen to us, they'll definitely listen to you. So if you put out a press release, it will get printed. And so, you know, I mean, so that's something, if you're asking what you can do, that would be great. If you're asking what we can do, we're doing it, and obviously our results don't show the effectiveness they could, because we have 5 people that have signed up for it.
You know,
So-
I do think there needs to be clarification that this committee deals with the Oregon Medical Marijuana Program and not the Oregon Medical Marijuana Dispensary Program. Because there's a lot of
Oh, yeah.
confusion about that. You know, people think they're gonna
Or
get
legalization.
involved and have input into how the dispensary program works, and it just isn't the case, as we know.
Right.
So if you did something like that, it would be nice to, I don't know, whether one sentence or,
We can clarify.
yeah.
Yeah.
I think it says it on top of the application, anyway, I mean, to just try the application for us. I'll make sure that's done too.
Oh, sorry, there.
And in the interim, we could just go back to doing it the old fashioned way, walk up to people you know and say, I'd like you to apply to the ACMM.
Yeah, and
And that's what
that's what I've
that
been
is
doing
what
too, and that's one of the
I do,
people,
too.
yeah, was
Yeah.
from that, yeah, but, yeah,
I've
that's,
got one more victim to try.
yeah, I've got people that I actually wrote down names and stuff, so, in fact, that would be a request, I guess I'll make an open request to everybody here in this room, that we all may know at least one other person who would be a great candidate for us, and my request is for everybody to reach out and make a vigorous phone call to them. And, you know, not just me, but to really reach out at the highest level they feel comfortable reaching out to and requesting, because I think now more, in fact, I know now more than ever, it's imperative that we have, you know, informed advocates on this committee. And so, if we can all do our part, I'd appreciate it. Thank you. Are there any other dialogue items? Nope, okay, so look at that. Moving on. Oh, the fun and exciting. So I make a commitment not to get triggered by this, but this is the bylaws and the next steps. So in the last meeting, as an update, I wanted to have a meeting because talking about structural and complicated things like bylaws, I didn't have a comfort in just blindly passing things. So I requested that we do a special meeting with the OMMP to go over the bylaws, but they ran that up the flagpole and deemed that it wasn't pertinent to our mission, functioning bylaws. So therefore, a special meeting wasn't approved for them, and that on top of that, it seemed that it would be a waste of Shannon's time to assist in those bylaws, and that she wouldn't be available, nor would anybody at any legal capacity to assist us. And that's all there is to say. For me, I am on my end attempting and have reviewed the bylaws and come up with several ideas, and have employed some assistance with some other attorneys on a pro bono basis to assist in that process. Their specialty, unfortunately, is not public policy bylaws, like other people, the administration that support us would be able to have. So we're sort of left our own on that, and it's happened to me. So my request inside of that is, because the support won't be available, I was going to request that we, because we can, form a special subcommittee. Well, let me restate that. Can we form a special subcommittee?
Yep, you guys
Yeah, we-
you have a
that's
step.
what I
so-
thought.
I just want to be,
It's in the bylaws.
It's in the bylaws, but, so,
I think.
exactly, so is it that we should have sport professionals, but anyways, so I was gonna open it up and make a special request, one, to the medical marijuana community as a whole, and two, specifically to people here, if anybody be willing to assist me in that process. And what assistance looks like is that we set up a time that twice monthly that we meet, and then in the interim time that we will have accountable tasks to take action on. So it will be an action-based meetings, and then the in-person meeting will be going over what we created in that interim 2-week period. So there will be real accountability. You could expect it will take about, in the meetings, about 2 hours per meeting in twice monthly, so 4 hours of real